and everyone at CSIS for being our co-host today and providing this wonderful room for us for the show. And also acknowledge Isra Hussein from CSIS and Sarah Marston and Kate Brundell from Friends for really pulling the whole event together today. So thank you for that. We're going to see a film today. And then we're going to have a panel discussion and talk about your questions and thoughts and the issues and challenges raised in the film. And it's quite a panel we have to have that discussion. It includes a pioneer in strategic management of the world's largest AIDS program that is demonstrating incredibly impressive results year after year, a globally recognized expert in priority setting, resource allocation, and value for money in global health, and a universally respected former public health official, currently thought leader, and according to Forbes, one of the 100 most powerful women, I think, in the universe, but that could just be in the US. So I think this is a panel that will be able to solve all our problems and point the path forward after the film. This film is part of the PBS Great Decisions series produced by the Foreign Policy Association. And I do want to thank the Foreign Policy Association for focusing on this issue and doing the film. The series is comprised of 8 half-hour documentaries covering what they call essential topics in foreign policy. This episode looks at the history of U.S. global health leadership and then makes a statement. Foreign assistance has fallen out of favor in some circles in Washington, and the question is the golden age of global health coming to an end, or is it just beginning? So that's one of the questions we want to talk about in the panel discussion. I will say it's very encouraging that, and it's a sign of the evolution of the field of global health, that this topic would be included in a series like this that's looking at the biggest geopolitical issues. So we're very thankful for that. And this is an opportunity to reach interested foreign policy audiences and inform them more about the incredible legacy of U.S. investment in global health and what the challenges are looking ahead. This film is debuting in local areas all over the country now. It debuted on WHUT today, and it will be on WETA soon and around the country. With that, let's watch the film.
Hi, everyone. I'm Steve Morrison here in CSIS, and I'm going to offer a few remarks to open things up, and then we're going to have a conversation among ourselves, and then we're going to open things to you. I think it's great that this is happening at this particular time. I mean, we're approaching the 15th anniversary of PEPFAR next month. There's going to be quite a number of events that mark that moment, and a lot of introspection and reflection on what has happened in the past 15 years. I think this film was a nice tool in terms of covering a span of those major developments. It was particularly, I thought, interesting how much success they had in getting people like McChrystal, Hayden, Hagel to come on camera, along with many other folks that are here and others. I don't know if some of you remember, but when they came to town to do the taping here, it was incredibly hot.
Yeah,
as I recall.
That's why we all look.
We all look kind of sweaty.
It was really hot.
To varying degrees, but I do remember that being one of those dog days of July, in which at 9 o'clock in the morning you felt like you were going to shoot yourself. But in any case, it was good. So we have entered a period of new debate. We had last week Chris Murray from IHME, the Institute for Health Metrics and Evaluation, came here to launch, as he has in the last 4 years, to launch the annual Global Health Financing Report. We do that jointly with Kaiser Family Foundation. And there were some companion pieces that were spin-offs that published by The Lancet. That was videotaped. You can go back and watch it. And there was a conversation that happened afterwards with Mark Dybel, Jen Cates, and Chris Murray. It was very striking in that moment how much the debate is intensifying around where are we. And we've had a 23% reduction in the donor levels dedicated to HIV in just the last 3 years that's documented in that report. The U.S. position has remained fairly stable, fortunately. Congress has been particularly stalwart in its supports. But the bigger issues that are at play right now about where are we are really big. And this is a period of turbulence. This is a period of a certain mixed set of impressions. And I think the film that we saw does a pretty good job at trying to balance off a number of different considerations that are at play. We are seeing an intensified debate over the value of foreign aid. We see reference to the populist critique. We see the way in which reproductive health has reemerged as a source of difference of political collision around our culture wars. I think it's very valuable to have, as we see in this film, a sort of reaffirmation of what are the major arguments in favor of foreign aid, and those have all been laid out here. I think it's also important to remind everyone about the centrality of high-level U.S. diplomacy and leadership at the level of the White House. Clinton, I think President Clinton made some very important decisions. President Bush made some profoundly important decisions. President Obama carried that forward. It's important to remind ourselves that this became such a guiding element at a global level, at moving others to do more in that period. Health securities come to the fore as a major new concern, as we've seen, and the conclusion that this film doesn't really have a conclusion. It's a teaching tool. It's trying to put these issues out and then have people debate them themselves. So it's not trying to lead us to a specific set of conclusions, but it does leave us with, I think as Josh Michaud said, the jury is out on whether the golden age is over or still continuing or morphing into something else. Now, the folks that we have here to talk about this are all close friends. They're all people with remarkable continuity of commitment and engagement on these issues, stretching back to the earliest days in which we began to see these big actions happen. So there's a reason we saw each of these individuals in the film and a reason why they are here today. They're all very distinguished in their long-standing American veteran leaders of global health, covering the whole span of the last 15 years and indeed each even longer. And each has a commitment of deep, unflagging commitment, understanding, compassion, and each has left very deep impacts and continue to shape the debates and the discourses that we have around where we are and where we're going to go. We know that U.S. foreign aid levels for health have been flat and in certain areas are in decline. We know that threats and the fear that threats evoke come and go. HIV was fiercely felt in the period when PEPFAR was launched. It's less fiercely felt today, but as all of those who work these issues know, the dangers are still very, very real. Ebola was fiercely felt in 2014, less so today, but by those who work the issues is still a very live matter. And we know that the investments we've made are very mature, and that mobilizing long-term financing is difficult. There's nothing profoundly surprising about those conclusions. We are in a highly competitive environment. We're one in which people are questioning in an understandable way what do we derive from this and what are the relative priorities. So with that background, I want to begin by asking each, we'll start with Deborah, each of our speakers to offer just a couple of minutes, 2 to 3 minutes each, of opening remarks. And those are around how should we define this moment that we're in today? What is the most important dimension of this current moment that we need to keep front of mind as we think about the strategy that we need to pursue in sustaining the successes that we've seen here? Deborah, you want to kick things off for us, please?
Great. Well, it's just amazing to be with this panel and to be with this panel of strong women. The last time I saw this debate that was carried, it was all men. So thank you. Thank you for your gender diversity. There are a lot of women in global health. Sometimes they never make it to the stage, so I appreciate you doing that and doing it intentionally, which I'm sure you did. And thank you to both Chris and Steve for organizing us together for this discussion. I think my perspective has always been, how do we intentionally create space for each other to succeed and support each other's success? And what do I mean by that? We're intentionally looking every day, how do we support the global health security agenda? We have $700 million every year above site, what we call above site, in the health system, from supply chain to lab systems to RNA and DNA detection devices in every country. That's our contribution. And our other piece of that contribution is working with the community. Because often in these global health security debates and detection of the next biggest threat, they focus on technology in the lab. But the key to understanding that is the community. Do we understand what the diseases are in the community? Can we diagnose them? Will we find the outlier? I can't tell you for sure that we can, because when you look at what happened with HIV continued to expand for more than a decade before we had any idea that HIV was on the planet. It wasn't until people started falling ill 10 years into their disease that we woke up. It was too late. HIV was everywhere by the time we woke up. We can't, if we have another zoonotic event like that, like he describes, we can't wake up that late. But have we created that detection systems in the community so that you can respond early? Yes, acute infectious diseases, we will find those. It's the slow, deteriorating infectious diseases that destroy from within silently that we have to understand, can we find those? And that relates to our relationship with the communities and the governments and constantly facilitating that. So in PEPFAR, we've spent the last 4 years really reading what others have written about us to really understand how we could do better, looking backwards so that we could be better forwards, and then working intentionally with governments and communities to find that triangulation where we have an impact on malaria, we have an impact on TB, but we have an impact on the system that's out there to detect the next pandemic. That's our contribution. We take that seriously every day. We are making slow, iterative progress. There's still places where, we've put billions into the supply chain and we're still looking for where that supply chain is working perfectly. We haven't found that yet, but we're continuing to invest. I think together we've made incredible progress in the lab systems across the world. And there's really high-tech lab systems set up to see people in the health post, the clinic, the district hospital, the regional hospitals, all the way up to the reference lab in each one of these countries. And I think that's a huge accomplishment, but we also have to know what disease looks like. And I think we're still working on that. And then my final comment, the health system was set up for sickness in sub-Saharan Africa. It was set up for pregnant women and it was set up for under 5. So the majority of the individuals that are in sub-Saharan Africa, the 60% that are under 20, have no access to the healthcare delivery system nor any reason to go there. So if we don't figure out a way to have the well people come to the clinic to be diagnosed, to be supported, if we can't find a way to attract 25-year-old men, we won't be able to deal with the next pandemic because it will silently spread in communities without being visible within the healthcare delivery system. And that's the part we're working very intentionally on now.
Thank you. Amanda, how do you define this moment that we're in right now?
Well, first, I'm so pleased to be on this panel and honored, but also that I was able to mention drug-resistant gonorrhea on national TV. That's, I think, what we're seeing is that the money that's available is the same. Last week, the IMF held its spring meetings, and their World Economic Outlook report showed that about 24 low-income countries would actually see a decrease in per capita income in the next couple of years. So it's not all a good news story in terms of the growth of domestic economies and possible revenue. And in that context, we're also envisioning scaling up global health efforts. And so that leads to the question, how can we do things more efficiently and meet all of the goals that we've set for ourselves as the global health community, those very ambitious goals? So I'd put that out there as sort of one macro issue that we're facing going forward. The second is that I feel that we're still very vulnerable on the global health security issues. I see my colleague from the Centers for Disease Control who kindly shared with me some frightening articles that look at the economic impact for the United States of outbreaks in major trading partners. So in the 49 global health security priority countries, these authors found that US exports of about $308 billion and 1.6 million jobs would be vulnerable should there be a significant outbreak. And what are we doing about this? I think we were all very pleased to see that there was a Global Health Emergency Fund set up in FY17, that there's some money tagged to the Global Health Security Agenda, but of that, about 100 is unspent Ebola money. So just to say, we're still not prioritizing global health security and preparedness, and it's not clear how we plan to fund all of the many needs that are identified in the joint external evaluation process that has been run by that agenda. So those are the two big issues I'm worried about as I look forward to global health.
Thank you. Chris?
I think we're at a point where we need to, as Americans, ask ourselves, what is the end goal of these terrific investments that we've made in global health? Where are we going with this investment? And I think that the answer to that, the strategic answer to that, is that we need to be in this game to end these epidemics. And we need to think about and honestly assess what it's going to take to move towards ending the biggest infectious diseases, and as we do that, build health systems that are sustainable, bring implementing countries into increasingly funding their own responses. But I think we need to have an end game in mind and fund accordingly and manage accordingly. I came to the financing event here at CSIS last week that Steve referred to. It was great. And Dr. Jen Cates was on the panel, and she said that most of us, and she observed that most of us in the audience have been lucky because in our professional lifetimes, we've seen these catalytic events that drove global health forward in our country. That includes AIDS activism. It includes President George W. Bush. And she asked, what's going to be the next catalytic thing that moves us forward? And I think that's the question. She didn't seem to have the answer. I don't. But I think we all need to be asking, what is the thing that takes us to this next level, increases our drive to move towards ending the epidemics and the other goals in global health? I believe there could be another golden age of global health. I absolutely know that that's possible. I also know it'll be different than the golden age that came before. It's going to involve more money from implementing countries, more decision-making authority from implementing countries. It's going to involve probably more private capital in some environments. It's going to involve using donor aid in new and more catalytic ways. But I believe that there's every rational reason to have that golden age again. It's a political decision whether we go there. It's a political decision to have flat-funded global health for 9 years in the face of huge returns on investment and continuing need. It would be a political decision to decide that America is going to lead a global challenge to end the 3 biggest infectious diseases. It is doable. I hope that we seize the HLM for tuberculosis this year as a great political opportunity. I hope that globally, the world that is really interested in the universal health coverage movement seizes that, but thinks about what Richard Horton wrote 2 weeks ago in The Lancet, that if you look at the history of global health accomplishment, a lot of that was with vertical programs. So let's figure out how to make a mix of vertical and horizontal programs effective and build out to UHC. And with health security, I think we need to seize that as a real threat. It's very real. And we also need to be thinking about, as Peter Sands of the Global Fund says, that health security to people on the ground in countries means both diseases that are killing them now, but also the possible disease threats of the future.
Elaine.
Yeah, and I will just add my thanks and appreciation also to the conveners, and also great to see so many friends and colleagues for over the many, many, many years. I think when you're talking about people whose careers have been very, very long, I think you were talking about me being the oldest person on the panel, I think. But anyway, I guess I think, I'm a bit schizophrenic on this. On one hand, I feel incredibly hopeful. I think that that while we have moved to a different phase, HIV, other global health issues are maybe not capturing the same attention that they did. There's a lot going on, and there's a lot going on sometimes in quiet, almost unnoticed ways. And I think that the things that you mentioned earlier, Debbie, about some of the capacity building that's happening, the fact that there are so many capable people in the countries in which we work, totally different landscape than when I first started Global Health, where it was so critical to have external expertise. Now you have that expertise on the ground in a way like never before. I think people are starting to think differently and smarter about how we do things. We're looking at financing in all sorts of innovative ways that we never thought of. And so I think we can do our work differently, and I think things are continuing to happen, even if they're not grabbing the attention. On the other hand, when I look at the film and think about what is at stake if we don't keep the kind of attention and pressure on to make sure that we continue, as you said, Chris, to think about the end game. It's so easy to get swept up in the moment, and we've all seen the different waves. It was HIV, then it was malaria and TB, and then Ebola came along, and so I think we have to fight the ADD that I think goes along with the new disease of the moment, and recognize that if we don't continue to hold our leaders accountable, that we could very well look up a decade, 2 decades, 3 decades from now and really wonder why we let so many people die, why we let so much tragedy occur. So I think we have to think about the long game. I will just end by saying I am incredibly optimistic, though, for another reason, not only what's going on in the country, but because of young people in this country. Everywhere you go, and not just in this country, but around the world, global health and the idea that we owe each other something and that we're part of a global community is really something that is evident more than ever. I mean, I go on campuses all the time. Global health is now the most popular major on so many college campuses. And so just like we saw the young people leading the march around gun and gun violence, I believe the same sort of thing is going to happen if we let up, if we as adults let up. I think young people are not going to let us forget that we have an obligation to the rest of the world, and that, as Joe Lieberman said, it is our moral responsibility. We know all the economic arguments, we know the health imperatives, but I think it is really our moral responsibility to make sure that we don't forget it, and I think our young people won't let us.
One thing that we haven't mentioned, which I think is an important consideration in talking about the durability of U.S. commitments, is that, yes, there's been 9 years of flat funding, but in those 9 years, we've experienced a colossal economic setback in 08 and 09 that put us at the edge of true systemic crisis. And we've had a political transformation here in the 2016 elections that was totally unforeseen, really, until the moment it happened, and yet there's been a pretty consistent support through that period, and I think that's important to remind ourselves. I do think we are when we talk about leadership, we're in a very different environment. We're in the era of SDGs, so we've got health as one of 16, and health as 10 of 169 indicators. That's a different world. We're in the world of universal health coverage, and we're in the world of populism and nationalism. And it's not just in our White House or in Downing Street where that is true. It's true to varying degrees in Germany and Norway and France. And this is also in the midst of the migration crisis, in the different sense of security, the security debates that exist today, particularly in Europe. We know that strong high-level leadership in the White House, in Downing Street, and in these other capitals was decisive at moving things forward in those big catalytic moments. We're not going to see that same kind of leadership in this next period. So then the question is, where do we look to today for high-level sustained leadership? It can come from different places. We've already seen a reset in the relative relationship between Congress and the administration in what's happened in the past 16 months. That's one indication. And leadership comes from within an administration from different places, too, as we've seen today. I mean, we have Ambassador Birx here on stage, who's been a formidable leader in this respect. So I'm going to reverse course here and start with you, Helene, to tell us what do you think in terms of where should we, you mentioned youth, and that's one answer, I think that's an important one. But what more would you say in terms of where to look for leadership in this period?
Well, I think we look to leadership from a lot of the countries in which we work. I think there's very clear and very strong leadership, including young people in Africa and Asia and around the world. So I do think that we have to look for leadership outside of only thinking about United States and European allies. I think we also have to look outside of our capitals. You know, I now live in the heartland. You know, it's amazing for me to see how important these issues are to increasingly to the average American. And I think the work that has been done over time, whether it's organizations like ONE or USGLC and others who have really worked to make sure that throughout our country we understand the connectedness of these issues to issues that people care about. And so I think that at a time when we can't necessarily expect that the leadership is all going to come from capitals, we've got to look beyond and beyond our capitals, but also beyond our nation, and recognize that we have built a different kind of cadre on the ground in the countries in which we work. And I don't think that people are going to allow us to walk away and leave people dying and leave them to their fate. I think we're going to get a different kind of activism if we're not actually holding up to our commitments in the long run.
Thank you. Chris?
Yeah, like Elaine, I have the feeling that there really is leadership out there ready to rise up. I think it is young people. We've seen that in our own country really recently, and I think that young people will hold us to account. But there's so many ways in which we can be investing in partnerships now to nurture that leadership with the faith community, which was critical at the beginning of PEPFAR and the Global Fund. I think there's way more we can do with the business community and being involved, technical support, financing. Gates Foundation recently funded a survey of what messages resonate with Americans, and scientists are highly credible to many Americans. How can we make scientists increasingly visible in all this? So I think we need to do more to nurture that, certainly lay out the case, but also nurture new leaders in coming forward. I think the HLM on tuberculosis is a huge leadership opportunity for middle-income countries that are heavily affected by tuberculosis. And India has recently really committed on a stepped-up TB response. I think we need to be blasting that all over the world so that leaders all over the world know that India stepped up, and what are the other countries that are really affected by TB going to do. I think we've got several replenishments. We need to think about this question hard because we have multiple replenishments for global health entities coming in 2019, including the Global Fund and Gavi. And each of these programs is unique and deserves strong funding. So we need to find leaders that can speak to that. I will say one thing too about Capitol Hill, which is we are blessed with champions on Capitol Hill that save us every year, that really lead the effort. I think we need to do more for them. It would be great if we did more to help them hear from their constituents who care about it, because I think they can use that reinforcement. They say they can. I heard Lindsey Graham recently say that never forget that changing someone's attitude, a senator's attitude on Capitol Hill, on changing his or her attitude on foreign assistance is just 2 phone calls away from 2 faith leaders in their state. So let's remember that. We can recruit new champions here by getting faith and business and youth and other constituencies involved. And then I think we need to invest in advocacy in civil society all over the world so that implementing countries get more in the game, middle income countries too. We need to invest in civil society as catalysts.
Amanda.
So I think if we're talking about global health outcomes, the leadership that matters is in the large countries that have a lot of disease burden. So if India decides to put out Modi Care, as it's sometimes called in the press, that's an insurance scheme to cover 500 million people. What is in their benefits package? How does it track to global health needs? Why is it only reimbursing secondary and tertiary care? There's a lot of big issues that are around the big middle incomes and the way they are structuring their own health financing and priorities, where lots of the expertise that exists in the global health world can make a difference. On the sort of donor side, I'm perplexed because really there are 5 sources of big money in our field. And they are giving money through a multiplicity of mechanisms and channels. We're in a season of replenishment. And we need to tell a coherent story about how all these pieces fit together, how they fit together with transition, and what impact we're having. And we need to double down on performance. You've been such a leader in this area about using data to focus investment. And I mean, I'm just to give you a sense, Gavi has done an enormous job, has bought so much vaccine to countries that need it. But take the country of Ethiopia. The 2016 Demographic and Health Survey finds that 39% of kids are fully vaccinated by the time they reach 2 years old, after 1.2 billion in Gavi support since 2001. Why? Okay, there's lots of reasons why. It's not only about Gavi, we all know that. But I guess the question is, why can't we focus on that thing we want to get done more sharply? Why can't we be accountable for that, for retaining AIDS patients, for fully immunized children? Let's shift to that, because that will make our advocacy so much more effective. It makes its own argument. Thanks.
Ambassador.
Yeah, I'm just going to tie together some of the things that you all said, because I think it's incredibly powerful. I think talking about the capacity that has driven on the ground and being clear about the policies that are needed to make our dollars more successful. I mean, we've been able to double the number of people that we're serving just in the last 4 years by working with governments to get the policies that are needed to make those programs effective. We never give real credit to that. I mean, we talk about dollars, but policy sometimes can make your dollar go 10 times further. And so we've concentrated a lot on the policies because a lot of countries relied on immunization days. They have relied on motorcycles, bringing vaccines to villages. If they had built that health center with a nurse who was giving immunizations to everybody as they were born and coming into the clinic at 6 months, and there wasn't a stock out, then we would have 80-90% coverage. You cannot get to 90% coverage by having immunization days. You can't get to 90% coverage by sending in motorcycles. You get to 90% coverage by working with countries to develop the policies, that system, and that clinic that is needed to deliver those pieces. And I think that we do need more leadership out of the AU, making it very clear about the expectations. I think at one time we had extraordinary powerful leadership out of the G7. They drove a lot of the investments in the Global Fund. It drove a lot of the bilateral programs in the United States. Neither the G7 or the AU are talking about these pieces and talking about the end game. So I think part of it is us being very clear about how that end game gets accomplished, and then the side benefits that are achieved. But it's also on us to be better about intentionally coordinating with each other. I mean, there's no reason why our program working on HIV prevention with young women isn't measuring child marriage, rape, and all the other issues in teen pregnancies that young girls face, and working with governments to find solutions for those. Because if you measure it and you get it to the governments, change happens. And that's why, yes, we measure performance. We just got done all last week meeting with all of our partners and being very clear about the performance we expected. And the partners were so good about it because, up on all of their data for their last year, and we said, nope, not good. That's good, not good, good, not good. And in a very clear way. And so people heard all the messages the same, whether you were an indigenous partner or an international partner. You got called out in the same way. Because the need, it's on us. We closed our COP meetings a couple months ago in Johannesburg with an individual who came from the Ukraine, from the community. And he said, I recently had a baby, and I was so worried because I was so worried about the doctor's ability to care for my wife and my unborn child. And I just sat outside praying that his hands would transform and my baby and my wife would be safe. And he says, that's how the AIDS community looks at all of you. They pray every day that your hands and dollars will transform into a response that's going to stop this pandemic. I'm sure that's how mothers feel about malaria. I'm sure how others feel about TB. It's in our hands. But I think we also have to ensure it's in the AU hands, in the G7 hands, and that people are really talking about the issues in a very clear way and showing how vertical programs create the end game that everybody wants to see. And I think we have that within our capacity, but we're not displaying it that way. You are trying to do that, so thank you, so are you. But I think we could do a better job in making it much more clear.
Thank you. Just to summarize a bit here, on the G7, G20, and AU fronts, I agree that there's a huge question mark. Where is the leadership? The Argentine Minister of Health was here on Friday. They're hosting the G20. Health is off the agenda. The AU, it's been a long time since we've seen heads of state from the key AU member states show up at the international AIDS conferences or show up at any other venues. The threat has subsided. They've moved on to other priorities. G7, when you've got a majority of your of the members now in a completely different frame of mind ideologically, it's a different world. I think we are in a period of sober realism and a period of uncertainty and reflection, but I also think we're in a period where people are feeling fairly feisty, as I think we've seen here, which is people are not in retreat, they're not giving up, and they're not panicked. And I think that's a very, very important point to make, that we are in a period of turbulence and reassessment and uncertainty, but it's very important to stay calm and confident and stay engaged and move this forward. We're going to open for some remarks. Please identify yourself. Please be very succinct. We'll bundle together several and come back to our speakers. I know that Helene has to run to a plane in a few minutes, so you might want to target the first round of questions to her if you feel so inclined. Can we do that? Can I?
5 minutes.
5 minutes? So down here is a hand. And let's take 3 or 4 and over here.
Hi, my name is Angelita. My question is about the end game, because from what I hear from the discussion, there are supposed to be like 4 priorities. One is education, funding, research, and treatment. But my questions are: one is, how effective are we in partnering with non-government organizations, the UN organizations, the universities within the countries themselves, and if they have their own emergency systems, like the FEMA or the National Guard, which delivers the service directly. And then related to that is, hold on one second, is how effective are we in developing the health systems in the countries themselves? A lot of people outside the United States wants to be health practitioners, nurses, and doctors, and then migrate to the United States because there's money here. But actually, they're more needed in their countries too. So that's my 2 questions.
Hi, everyone. Thanks for your remarks. Lois Pace with the Global Fund. having trouble with this. I will direct my question partly to Helene, but I think others can respond as well. One thing I didn't hear was the tie to local solutions. I think there's a huge opportunity that we could miss to really tie what we've been doing, the investments that we've been making globally and what we've gained, to the needs we still have here. I mean, we're sitting here in DC and talking about rates of HIV, we talk about maternal mortality in this country and the reports that have surfaced. And coming back to your comment, Helene, about where young people are, when I talk to young people on campuses and otherwise, they're talking about social determinants and they're talking about disparities right here and how that connects to the disparities we're trying to address abroad. So curious or seeking advice on how we communicate that in our advocacy and even what you're hearing from others in terms of connecting those dots. Thank you.
Do we have any other comments or questions? Back here? Then we'll come back to it.
Hello, my name is Gary Krebs. I'm a professor at George Mason University where I direct the Center for Health and Communication. The issue that I'm concerned about is ways of promoting cooperation and coordination across all the nations. I know that we use both vertical and horizontal approaches, but I think that if we could work together more collaboratively, we can do a much smarter job of utilizing resources in a more effective way. It's not only a matter of increasing the resources, but allocating them and utilizing them in ways that are effective and sharing strategies across countries. And I think we need to, I know that the infectious diseases get a lot of attention because they're scary, but there's a wide range of issues like, thank you. There's a wide range of issues like cancer and heart disease and reproductive health and environmental health and violence and mental health issues that are really pandemic issues that need to be addressed, that are shared across these nations. How do we find ways to work together collaboratively and share resources and strategies to address these wider health issues?
Thank you. Thank you. Helene, before you go, you want to offer some remarks?
Yeah, well, just a couple of things. One, on the last point, I think one of the things, and several people have brought this out, is that one of the things that I think was really good around the way a lot of the work was done to respond to HIV was that while HIV was the particular issue, the resources were also used in a way that helped to build the health infrastructure overall. I think we could have done a better job, but I think all things being equal, there was a lot of focus put on how to strengthen the health infrastructure overall, how to look at things that are interrelated like pregnancy and rape and other issues that you mentioned, Debbie. So I think we've done a fairly good job. We could do a better job. You also mentioned the issue of collaboration, and I think it's a key issue. I think we need to figure out how do we get people to actually fund collaboration. It is one of those things that everybody talks about, but everybody who has ever tried to collaborate knows how much extra time it takes. And collaboration doesn't just happen. Everybody has their own roles to play. So I think we need to think about that and think about how do we do that in a smarter way. I, again, continue to be optimistic because I think we are learning as we go along and getting smarter about how we do our work. But one of your comments made me think about the whole issue of building partnerships. One of the reasons why HIV was on the map was because people were really smart about bringing in the security issue, bringing in the military, bringing in others to think about it. And so I think we need to sometimes go revisit our playbook. And while we're continuing to learn new things, also not forget some of the lessons that we learned in the past. And just finally on the issue of domestic and global, totally agree. I'm now back doing primarily domestic work. And the parallels, and part of the reason that I am is because when I looked up 30 years later, having primarily focused on global issues, coming back and realizing that some of the huge disparities haven't shifted, and I think we have not thought about as creatively how to use innovations here in this country as we have globally. So I think there's a lot of bi-directional learning that needs to take place. And one of the things that I've been able to do is to take a lot of my global learnings to the domestic situation where, I think we so badly need to think in a much more holistic way around how we think about things like social determinants of health, et cetera. So I urge all of us who have worked in the global arena to think about how we make that. And again, for advocacy, as you mentioned, I think it actually is very helpful when people realize that the same issues that we're talking about globally are important here and vice versa. We get domestic advocates for the global situation and vice versa. So I think there's a lot more that needs to be done. Unfortunately, planes don't wait for individuals, so I'm going to run. Thank you.
Thank you very much, Elaine.
Thank you very much.
Who would like to jump in? Chris?
I just, Lois, you talked about that young people are interested in the context. And I think that's a huge theme for the future in global health. Part of that is marginalized people and key populations. And that is, one of the great next hurdles, and we're already confronting that and doing things to reach people. But there's so much more to go in terms of wrestling with what do we do when people are marginalized in their own communities and in their own countries. It's a financing question too. As financing in global health changes and it becomes more domestically oriented to the degree there's private money involved, donor funding remains absolutely essential for many reasons. One is that donors are often willing to go to those key populations groups that the countries themselves won't. So I think that is a huge area for discussion and activism in the future is how to reach marginalized people that we're coming up against very quickly. And also just say really quickly, on the effort to really hold ourselves to move towards ending these epidemics, I think data is the other big thing that's going to be huge in this. And Ambassador Birx, to echo you, been such a leader. I love your new website full of an amazing data display from the PEPFAR program. That is a model of where I think the whole field needs to go in terms of that kind of availability of data, allowing people to be strategic, focusing us on outcomes, acknowledging, where we need better data. That's all part of it. But I think that's a huge theme going forward.
It's what allows us to get to that communication question. When we started mapping people and geography, we found, as many have found, that 80% of disease is in 20% of the geography. That was hard for people because the whole system was based on equal. You send 20 of this to the 20 places for the 20 people. Unfortunately, those 20 people aren't in those 20 places. And so really, when we started matching disease and needs, both prevention and treatment, with the geography and the age groups that are in that geography, because just as leadership is changing, the world is changing. And this urbanization piece in Africa is changing the whole continent, with 3% of the 25 to 40-year-olds moving into the urban areas. That changes your whole health dynamics, and you have to be constantly working on those. But that's why we put it on a website, so that people can constantly see how they're doing, but the changes that need to be made. Because we like to do one thing and do it for a year, and then, or 5 years, because change is very difficult. But now we change quarterly, and that has really been, I think, part of the reason we've been much more effective with the U.S. taxpayer dollars. And I think this administration is giving us, I don't think they're against global health, because they've been very supportive of PEPFAR. I think they're about, why aren't you applying business practices to these health programs? Why are you running them by perception rather than data? And we have run health programs by perception. We believe that the community needs what we're going to give them, but we haven't taken the time to find out if that's what that community needs or not. And I think this is a wake-up call for us to be much more detail-oriented, to tie dollars to impact, and then show what the end game is. And I think the end game is different. And we've been really working on this global domestic sharing because we've learned a lot from the solutions people have found on the ground. We couldn't find men. So they found out that men wanted to go to other men. I don't know why. So we brought in male healthcare workers, we brought in male nurses, and we created a male corner. So when they walk into the health clinic, they see other men. They immediately go, okay, there's others of me here, I'm okay. And then they have come in by hordes. That was developed by Lesotho. We said, we have a problem. Lesotho said, I think we have an answer. So the dialogue with data has changed the whole thing, because if Lesotho said to some people before, I think, we're creating these men's corners, everybody would have said, oh, it's Lesotho. Now Lesotho comes up there, shows all their graphs, and said we went from seeing 200 men to 2,000 men in 6 weeks using these male corners. It wakes up Kenya. Kenya goes, oh, look at what Lesotho's done. So I think that's on all of us to be able to create that venue for that dialogue. And that's what I learned from Amanda's team. And that's what I learned from BCIU, that you have to make your data visible so that you're constantly using it to make your programs better.
Yeah, and I think, the geolocation of information about service delivery is so powerful. There's that great project at William & Mary, Aid Data. And I hope that they will help us look at what are the effects of things like the Mexico City policy. Is it affecting, how is service delivery being affected? Is there a problem or is there not a problem? So it's that kind of granularity that we need to move to in terms of data. I wanted to reflect on the question about health system strengthening. So, one answer to looking at a lot of different disease programs is to say, well, actually what we need is, primary health care. We need a health system to deliver it. But much of that discussion has focused on the inputs to the health system. So human resources, how much am I doing training, things like that. We can count all that stuff, but what really matters is the ability of the health system to deliver on the disease goals on the one hand, on the preparedness, the detection of diseases, and that they're funding progressively towards the things that make the most difference for health system goals, like health, but also financial protection. So I hope that health systems conversation also shifts in the direction of the results that we expect to see from the health system. On the question about incentives to collaborate, I'm really worried about this issue, and I think at minimum, I hope that we can come up with a story about how all these mechanisms fit together, and make it very compelling, and to have perhaps a joint results framework that keeps everyone moving in the same direction. Maybe we can harmonize on data rather than trying to harmonize always on activity. Maybe that data will drive the harmonization forward. It would help to have some funding that would mandate that kind of collaboration as well. I think we've created an ecosystem where there are many, many voices, and we are all part of that. We're speaking for the things that we have been funded to work on and to be interested in. So hopefully the funders themselves will take a step back and say, gosh, am I funding advocacy in the way that is most going to get us to the results as quickly as possible?
Thank you. We have a question down in front. Are there any others? And in back? Please identify yourself.
Hello, thank you very much for your time and for all of your efforts throughout your long careers. My name is Abby Anir. I'm from the Committee on Foreign Affairs up at the House. And during the film, Mr. Collins, I believe you said that one of the keys to reaching our end game is being very vigilant, and making sure that we know where our funds are going and how, if they are being misused. And so my question to all three of you, but specifically to you, Ambassador, how capable are we of monitoring this, being very vigilant when there are still plenty of vacancies in many field offices that are supposed to be monitoring and coordinating all of these things? So, thank you.
Thank you. In the rear.
Yes. Good afternoon to the group. John Shaw, retired Senior Foreign Service, U.S. Department of Agriculture. And one of the panelists talked about the diseases to come. And others have talked about collaboration. And I just want to remind the group that 75% of new and emerging diseases will emerge from animal populations. So if we're talking about collaboration, I think we need to maybe look even a little further upstream. And the human health area cannot go forward if they're not pulling along the veterinary part of the house in all of these countries. And I think veterinary infrastructure has fallen on very hard times in most of the developing world. And for example, if you're going to look at tuberculosis in India and not look at TB in the cattle population, you are really kind of covering the sun with a finger. like they say in Latin America. Thank you.
Okay, we're getting to the end of our time here, so why don't we start with you, Deborah?
So I'll be very brief. We can track and trace every dollar through every partner to every activity, and to then the results in the activity. So we can track the dollars spent to what was accomplished and be very clear. And we call out partners if they've overspent and underperformed. You can underperform, but then you must underspend. Because we know that there will be barriers in performance sometimes. So we're very clear about that. And I think what you need to start doing is asking, because the staffers drive all of our programs. They need to start asking every foreign assistance program, can you track the dollars to an outcome and an impact? Do you know what geography it's going to? Do you know how many children are in that school? Do you know how many girls and boys are served? How many are not served? I mean, these are questions that we have to be really. It would be like if you went to Starbucks that never sold a cappuccino, yet they were making 10 a day. I mean, they wouldn't do that, so we shouldn't be doing that. And I think it's really on us to really bring that same level of performance to our foreign assistance dollars. We can't just rely on every 5-year demographic health surveys and say we're making progress, because that's not soon enough and not quick enough. I agree completely with the veterinary piece. Ebola, HIV, all zoonotic, avian flu, zoonotic. I mean, we deal with this all the time. Many of the countries have a veterinary institute, and I agree completely. Many times it's crumbled, and so you raise a really critical point, and I think it's a really essential component of the global health security agenda, because if we don't have that bi-directional work and that understanding, we won't prevent the next zoonotic event, or even detect it until it's long gone.
Amanda, any closing
What
remarks?
she said.
Okay, Chris?
What she said.
What she said. Okay, that's a very nice, clean conclusion. So I want to thank our speakers for their insights, for their incredible leadership in this field and commitment over the decades in this field. We're all in your debt, and we're very grateful that you would be with us today to share all of these insights. So please join me in thanking you.